People come in and they have something that's happened, whether it's a bad dental experience or whether it's something that has nothing to do with the dentist, and they're just terrified of needles or whatever the case may be. So for us, it's just more of talking to the patient, trying to figure out what is it that makes them anxious about being there. Whether it's just the sound of the drill, if it's just the fact that they're there, and they just can't even bear to bring themselves, we do offer Valium, which is kind of an anti-anxiety medication for patients, and people can take 1 or 2 tablets and come in as long as somebody brings them and takes them home. And most of the time, I'd say about 99% of the time, that works really, really well. Other than that, the staff, the atmosphere of the office, it's very calming and relaxing. It's not spa-like, but it is, just one of those things where people comment all the time. I just didn't think I could do this, and now that I'm here, this is super easy. And the other thing that we like to do is offer the anxious patient as much treatment in one sitting as they'd like to do. We have kind of bite rests so that if you're going to be open for a long time, your jaw doesn't get tired. With the TVs and the headphones and all, you can kind of drown out most of the stuff that makes people anxious. And then as far as the anesthetic goes, we really, really strive to give a pain-free injection. For us, that's really the most important part, because once somebody's numb, the procedure usually goes fairly well. And so once we find out what's making whoever it is anxious, then we can kind of customize that anti-anxiety protocol for that patient.